What is monkeypox and how worried should we be? A Q&A with Dr. John Swartzberg, Clinical Professor Emeritus of Infectious Diseases and Vaccinology at UC Berkeley School of Public Health. What is monkeypox and where did it originate?
Well, monkeypox is a virus in the same family as smallpox, but fortunately it doesn't cause nearly as severe a disease as smallpox does. We've known about it for, well, a little bit over 70 years. Prior to the 1970s, it had been exclusively in Central and Western Africa, causing human cases in a scattered fashion, with some significant morbidity and some mortality. The mortality rates ranging anywhere from 1 to 10% in Central and Western Africa. So it's not a benign disease, but we hadn't seen it outside of Central or Western Africa until some scattered cases in the 70s, and then there was an outbreak here in the United States in 2002, associated with the importation of some rodents from Africa and getting into the prairie dog population, and then some human cases from that. So we've seen cases occur outside of Africa, but nothing like what we're seeing with this outbreak.
How does one contract monkeypox and how does it spread?
As I said, we've known about this disease for over a half a century, yet we haven't put a lot of effort into understanding it really well. And one of the things we just don't understand really well is how it's transmitted. Now, what we do know is that the primary means of transmission is by skin-to-skin contact. If somebody's got monkeypox and they've got lesions, that we know that that's a way, and you rub up against that skin, that's a way you can get it. That's clear that that's a very important means of transmission. We also know that the virus is found in oral secretions, because you can get lesions inside your mouth as well. And those oral secretions can get distributed in the air. So there's the concern that maybe this plays a role in transmission. If it does, we don't think it plays a major role, but maybe it does.
How does the virus impact those who contract it?
Now, the worst case scenario is that this virus can extend beyond the skin, or what we call the mucous membranes, like in your mouth, and can get into your bloodstream and go elsewhere in your body. And it can cause very severe disease and even death. That's pretty rare. We've only seen very few cases. I think 4 or 6 deaths have been reported outside of Africa with this outbreak out of thousands and thousands of cases. So it's very rare to see death. We have seen people requiring hospitalizations. That's not common, but it does certainly happen. It's because some of these lesions can be very, very painful, can cause difficulty with having a bowel movement or difficulty with urination. The skin lesions can get secondarily infected with bacteria, so it can be very serious in that regard. And for those people who don't require hospitalization, it means they're going to suffer often for anywhere from 2 to 4 weeks from really very uncomfortable and sometimes painful lesions, and difficulty with urination or difficulty with defecation are some of the complications that we're seeing for outpatients. So it's not just a run-of-the-mill benign disease.
Can someone be asymptomatic and possibly be a carrier?
Well, we don't know. There's no good evidence for that at this point, but there's just not a lot of good evidence is really the problem. We're not doing enough testing to know if there are people out there who are asymptomatically infected. We don't think it's a big problem at this point. We don't even know if it's an issue at this point. But being in the midst of a major outbreak and not having this kind of information is very reminiscent of the early days of COVID. But there's some big question marks about transmission that aren't really answered yet. One is, can somebody transmit it who's infected but not diseased? That is, they have the virus, but they aren't either yet manifesting it itself in terms of the skin lesions, or they have the virus and it just isn't causing any disease, so what we call asymptomatic infection. And can these folks transmit it? We just don't know have an answer to that. So there are still some substantial questions.
How can people protect themselves from contracting the virus, whether by getting vaccinated or by preventative measures they can take?
We do have vaccines against this virus. The bad news is they're not as available as we need them to be right now, but that over time is going to get fixed. But we do have vaccines that do work. We also have medications that work. In particular, there's a medication called tecovirimat, or TPOX is the brand name, that works very well. So these are things we didn't have with at the beginning of the COVID outbreak. The other thing that's terribly important is that you don't have to worry about getting monkeypox going into the grocery store or going out to dinner at a restaurant where without a mask on right now with COVID, you have to worry about getting COVID if you're in indoor places, because the virus clearly transmits in the air and you can inhale that. Monkeypox is a disease where we're seeing it spread really by intimate contact between people. That's what's driving the pandemic right now, and that's what's going to continue to drive it. Whether there are other means of transmission, again, we just aren't sure, but we don't think they're very important. So the important thing is to recognize that unlike COVID, where you can just be minding your own business and get infected, with monkeypox, you just don't have to worry about getting infected unless you're going to be having really very close contact, intimate contact with others.
How does the vaccine work?
Yeah, the vaccine works like any vaccine. It winds up giving us protection. It educates our immune system to not allow the virus to continue to replicate in our body. So if we give the vaccine before you're exposed, which is the ideal situation, it should protect you from getting infected at all. And if it protects you against getting infected, it means you're not going to get diseased. If you have already been exposed to somebody, the incubation period for this virus is long. So with COVID, particularly with BA.5, the incubation period can be 2-3 days and you get sick. Here, the average is about 10 days or so. So if you've had an exposure to somebody, and you learn about it the next day, if you can get vaccinated within the first 4 days, it'll probably prevent you from getting sick. And if you can get vaccinated before you become ill, it's going to moderate how seriously ill you become. So the vaccines are really very helpful. We just need to make them available now.
Who should think about getting the vaccine?
Right now, most of the cases, something like 94 to 96% of the cases, are occurring in men who have sex with men. So this is currently the high-risk group. It's nothing about people who are bisexual. Males who are bisexual, for example, are exclusively having sex with men. That makes them more predisposed. It's just that's the group that currently is where it's bouncing back and forth in. We've seen some cases spill over now to females, and we've seen some cases of spillover to children. So it is starting to spill over into the general community, and that's what we have to completely stop. So the way to stop it now is to go for where most of the cases are, and most of the cases are occurring in men who have sex with men. So this is the group that needs to have a priority to get the vaccine.
What are some misconceptions that you've seen about monkeypox?
I think the biggest misconception is that there are certain people who are more predisposed to getting monkeypox, and that's just not true. All of us have the potential to get monkeypox, depending upon if we're exposed or not. So I think that's a major misconception that we have to really dispel. I think there are misconceptions about the role of the vaccine. I don't think people understand clearly how effective this vaccine can be, and when they should be getting it. I think that there's misconceptions about the role of, just from the name of the virus itself, monkeypox, which is a horrible name. The virus was first found in monkeys, but the monkeys got it probably from rodents, and this is probably a rodent virus, not a monkey virus. And so we ought to really change the name of this virus to get that misconception away. So like any new disease, there are probably lots of ideas. There's the role of inanimate objects in transmission. We know, for example, if somebody has monkeypox, that the virus is hardy and can live on, for example, the sheets of a bed. And so if you're sleeping in the same bed with somebody, you could get transmitted that way. But just shaking hands with somebody is not going to spread this virus. Rubbing up against somebody, if you're walking down the street and you bump into somebody, you're not going to get the virus this way. So there's a lot of misconception about how the virus is transmitted as well.
Monkeypox has been declared a public health emergency. How will that impact resources and management of the virus?
Congratulations to San Francisco and then New York as the two cities that declared it a public health emergency. And then congratulations to the state of California for doing it. And finally, congratulations to the national government for doing it. I think that it's clear in retrospect, the federal government was slow on the uptake with this in terms of responding adequately. It's always easy to be critical in hindsight, but I wish we had been a little more aggressive with this. The availability of the vaccine is a good example of how we could have been more aggressive in making it available to people who really need it now, as opposed to frustrating them and making their lives more miserable because of that, or because of the delay. Making it a national emergency now is going to make things a lot better very quickly. It gives the government authority and the ability to not only collect more data and more accurate data from the states, but it also gives the government greater ability to make the vaccine available, make the drug more available, without going through all the hoops that you have to go through with prescribing the drug. So I think it's going to facilitate things greatly, and we'll see the fruits of this pretty quickly, I think.
If you had a crystal ball, would you see the trajectory of this virus being more like COVID-19 or more like HIV?
It's certainly not going to be like COVID. We didn't know anything about COVID, obviously, because it never entered the human population until the end of 2019. So we had to learn very quickly about that virus. We now know how it's transmitted, and it's transmitted it transmits with facility. It transmits like measles. It's incredibly transmissible. HIV is transmits in a very different way. It's easier to prevent getting infected with HIV in many respects because it's not transmitted via the air like COVID is. SARS-CoV-2, the virus that causes COVID. But people who have HIV are asymptomatic for long periods of time, and they don't know they're infected. And so they, when you don't know when you're infected, it's much more easy to transmit the virus. So, but HIV does require intimate contact. It's a sexually transmitted infection, although it's transmitted in certainly other ways as well, like blood. Monkeypox is very different. The predominance of transmission occurs in people who already have sores. The sores typically although not always, are visible. So one knows when they're infected, and they're clearly contagious at that point. So that's something that's very helpful. I think the long incubation period, the long period of time between when you're infected and when you become symptomatic, gives us a chance to intervene where it doesn't really do that with COVID at all. So that's very helpful. And of course, as I mentioned earlier, the availability both of a drug and a vaccine now really can dramatically stop transmission. So we have all the tools right now at the beginning of this pandemic to stop it, whereas with COVID, we didn't have the vaccine for 11 months. We didn't have really drugs until just about 7, 8 months ago. So we're really way ahead of the curve in terms of what we can do. We just have to do it right now. If we could aggressively get people who are at high risk vaccinated, get people who are exposed vaccinated very quickly, get people treated very quickly, I think we can prevent a significant spillover into the general population and maybe prevent this from becoming an endemic disease, just another disease that we have to recognize is here and people are going to get. Unfortunately, because there's been such a delay in getting things done to prevent the spread of this virus, we may be already too late to prevent endemicity. We'll just have to wait and see. But if we're really aggressive now, we can knock this down to a very low level and not make it a great concern.
Any other thoughts you'd like to share?
It's been so hard dealing with COVID over these 2.5+ years. And now to be dealing with another virus that is spreading pretty quickly right now. It's really hard on the general population. It's certainly hard on me, thinking about this all the time, thinking now we have to deal with another infectious disease as well. I think all of this is a clear statement that we've been neglecting the scientific and public health view on what we call neglected infectious diseases that are occurring elsewhere in the world. We're just not paying enough attention to them. We could have controlled monkeypox in Central and Western Africa because we have had the vaccine for a good while, but we haven't bothered to do it. And this is the price you pay for it. It's also a commentary on the fact that the United States has been trying to do public health on the cheap for at least 3 to 4 decades. We're paying a dear price for that right now, dealing with the COVID pandemic and now dealing with the pandemic with monkeypox. And surely we're going to be dealing with pandemics going forward. We've been lecturing about the need to fund public health and the need to have a robust public health system for decades.
Yeah.
And it's like, you feel like Cassandra, who sees the future, but nobody will listen to her. And that's what it felt like. And now I hope people are listening to the fact that we can't continue to do public health on the cheap.